I'm Dr. Brad Bengtson, and you're watching the Plastic Surgery Channel.
When Stacy first came to see me, she knew that she had didn't know she had a deviated septum, I don't think, but she knew that her nose was crooked. And so the examination is really what diagnosed the deviated septum.
My name is Stacy Alexander. I'm 38. I was probably mid-30s, 33, 34, when I started thinking about rhinoplasty due to mainly deviated septum.
Your nasal septum is a piece of cartilage that divides your nose into a left and a right side. It runs straight down the middle of your nose usually, but most people's septum is deviated. And so it's not common to have a deviated septum. The big question is to what degree is it deviated? If it's deviated severely, then you're going to have probably breathing difficulties, and you also may have an external deformity because the septum, as it grows, will cause the nose to go to one side or the other. If it doesn't have enough space to grow and it's pushing, as the nose is growing, it may be pushing on the nasal bones and pushing one way or the other to make the nose appear deviated.
Dr. Gunner, as soon as he examined, my nose, he said, well, you are 70% deviated. No wonder you have had so many problems for so long. And he said, insurance will help pay for this, and you need to have this done. This will make your life so much better.
Well, if somebody has had constant congestion and blockage of the airway for quite some time, then they need to see a doctor that will do an internal examination of their nose, a plastic surgeon or an otolaryngologist, and especially if they want the shape of their nose changed also, have a rhinoplasty, because you can do a deviated nasal septum without doing a rhinoplasty. And so, they can see the doctor, and then if all they want is the deviated septum corrected, they can get that. Or if they want that in combination with the rhinoplasty, that can be done also.
Said, well, if I'm going to do that, then I want it to be perfect. Go ahead and let's fix it up. Take a little bit of the tip off and fix the hump in it,
The way we corrected a deviated septum is to actually, we try to put in what we call spreader grafts, and that is that if the septum is curved around like this, we will weaken the septum so we can shape it better, and then put in two pieces of cartilage on both sides of it and suture them together. And these two pieces of cartilage are stronger than the weakened septum, and so it looks like a sandwich with the septum in the middle of the meat, and then the two spreader grafts are the pieces of bread, and we suture those together, and that will straighten the septum. Back in the back of the nose, sometimes we just remove. You don't need that cartilage back in the back, and we just remove the deviated part of the septum.
I noticed a difference in my breathing immediately after surgery. My recovery was very, very easy. Honestly, I was in no pain at all. I never took one pain pill, never. Not even an Advil, a Tylenol. I was not in pain.
She also had a nose that was projecting, as you see on the post-operative pictures, and we decreased projection some. We straightened her nose. We also shaped the nasal tip so that it looked more refined and more sculpted in appearance.
The way it looks now, I would say that happened probably after 6 months. It wasn't swollen. I loved it. As soon as the bruising went away, I loved it.
So she got a very good result, both from an aesthetic standpoint and from a functional standpoint.